Hello everybody, my name is Dr. Harun Gupta and I'm the Program Director and Faculty at the PrimeRad Academy, and I'm pleased to announce the PrimeRad MSK Ultrasound Intervention Fellowship, which is a specialized program designed for radiologists to master ultrasound-guided MSK intervention with confidence and precision. With the image-guided interventions expanding rapidly, there has never been a better time for radiologists to learn ultrasound-guided MSK interventions. However, learning these techniques requires structured training, expert mentorship, and hands-on experience, and this is exactly what this training offers. The PrimeRad MSK Ultrasound Intervention Fellowship Program is a structured program of 3 months duration which focuses exclusively on MSK ultrasound guided intervention. It helps the radiologist master and refine their technique and gain as much procedural expertise during the fellowship as possible. There are few things which make this interventional program unique. Number one is there are 10 hours of recorded interventional videos and lectures which cover everything in the upper limb and lower limb intervention, covering shoulder, elbow, wrist and fingers, hip, knee, foot and ankle. Secondly, there will be a 2-day of interventional on-site workshop at a premier hospital center in Delhi. Thirdly, there will be one-of-a-kind humanoid mannequins which mimic the human anatomy and allow the procedures to be performed on them with ease. Hands-on training will focus on upper limb interventions, whilst the theoretical training with lectures and video demonstrations will cover interventions in both the upper limb and the lower limb. The hands-on component of the interventional fellowship will cover the upper limb interventions in the shoulder, elbow and the wrist region. In the shoulder region, 3 important injections in areas will be covered, covering glenohumeral joint, subacromial bursa and AC joint. In the elbow region, the epicondylitis injections will be covered and injection into the elbow joint. And in the wrist region, will be covering the carpal tunnel injection, the tendon sheet injection and lastly the radiocarpal joint injection. Now let me tell you about one of the standout feature of the fellowship program, which is the human-like mannequins. Thirdly and importantly, these mannequins are ultrasound compatible, which means that these can be scanned like human beings and interventional procedures can be performed with the needle accurately visualized within the different body parts. And lastly, these mannequins have been designed for repeated use, which means that the fellows can practice on them repeatedly and which helps build the confidence and master the technique of performing these injections. Now let's talk about dedicated hit the target sessions for improving accuracy. There will be specially designed models for allowing the fellows to practice on them for improving hand-eye coordination, needle accuracy, and overall learning to place the needle in the target with ease. With this, I welcome you all to join the future of MSK interventions. By the end of this fellowship, we expect you to have detailed knowledge of the procedures, the agents which are used, the various indications, contraindications, and all the aspects which one needs to know before performing interventional procedures. And lastly, there will be mentoring and learning from various faculty during this fellowship, which will elevate the experience further. So I welcome you all to come and join us for this exciting opportunity of learning MSK Ultrasound Guided Interventional Fellowship. See you all soon.